Good evening, everyone, and welcome to today's CERSI European Trainee Forum webinar titled Challenges, Complex Cases, and Complications in Interventional Radiology. My name is Maha Al-Katab, and I'm a radiology registrar at University Hospital Galway in Ireland, and I'm delighted to be moderating this session for you this evening.
The next thing I'm going to talk about is the Swiss cheese model of complications, okay? And the idea behind the Swiss cheese model is that it's delicious cheese to eat, but also that most complications don't happen for one particular person operating one particular way on one particular set of days. Most complications only happen when there is a chain of events leading to that complication to happen. And in interventional radiology, it's procedural based. There's a lot of people involved, a lot of teamwork, a lot of equipment. There's loads of different areas where you can get a hold for the Swiss cheese. And one of the theories is you avoid it by having various steps, and you talk about the different areas that the complication can happen. So they say education, training, policies, technology, communication, and checklists. And so your technical ability to do the procedure is only one small component of your job to prevent complications.
So it wasn't possible for the gastroenterologist to perform an ERCP due to the altered anatomy. So percutaneous transhepatic access was achieved by IOR. And you can see here the stone outlined in contrast. So in the past, what we would have done is tried to use a balloon to try and push this stone into the small bowel. And we tried that in this case, but it wouldn't move.
Challenging anatomy, as you can see from this 3D reconstruction. He has both posterior cerebral coming from the aneurysm, and the SCAs are quite near the neck, which is pretty wide. So this is really a challenge. When you at this kind of situation, of course, you would consult your colleagues. We normally always consult the neurosurgeons. We actually work as a team together to decide which would be the better approach in each case. In this case, with the neurosurgeons, we thought that the best option would be endovascular and not open surgery. And when you decide about endovascular, you have actually a quite wide toolbox where you can pick a different device. So you can do stents, you can do flow diverters, just coiling, you can do intrasaccular devices, stent coiling. So you have many, many options, and sometimes it's even difficult to decide what to do.
So we performed the angiogram, and the angiogram shows a reduced flow on the right side compared to the left side, first of all, and also the tight stenosis within the stent. We crossed the bifurcation with an 035 wire, and then we advanced the big 9 French kink-resistant sheath, and we performed a better angiogram, a more selective one, which better depicts the lesion